Good afternoon, everyone. After a long time, we are now today discussing one more topic of the respiratory system, which is very commonly asked. Now, let us start the discussion on this topic. We will have a discussion related to the exam going part, and which is very much important. It's an applied question as well as the early clinical exposure also of your syllabus, new syllabus. So the questions which are asked on this particular topic is define hypoxia, give its classification, explain any one type of hypoxia. Or it can be asked as define hypoxia, give its classification, and explain the role of oxygen therapy in hypoxia. So these are the very commonly asked questions. As a part of long answer question, these questions can be asked, or as a short answer question, these questions are asked, and they are favorite questions of the oral viva questions also. So let us start the discussion with the definition. The hypoxia is defined as deficiency of an adequate supply of oxygen to the body tissues. So whenever there is an efficient supply of oxygen to any of the tissues, this particular condition is known as hypoxia. It is classified into four major types. One is hypoxic hypoxia, second is anemic hypoxia, third is stagnant hypoxia, and the fourth one is histotoxic hypoxia. Now let us see what happens exactly in these particular types of hypoxia. So what exactly is hypoxic hypoxia? Now as the name itself suggests, there is the reduced oxygen tension in the arterial blood, and that creates a condition which is known as hypoxia, and it is termed as hypoxic hypoxia because there is a reduced oxygen tension. So in the blood itself, there will be a reduced oxygen tension. And this particular type of hypoxia is known as hypoxic type of hypoxia. What are the common causes? The most common causes is whenever there is a low oxygen partial pressure in the inhaled air itself, which is very commonly observed in conditions such as high altitude. Whenever you are at the top of the mountain, you have the oxygen pressure, partial pressure of oxygen very low in the air itself. And this creates a reduced oxygen tension in the arterial blood, leading to hypoxic hypoxia. So this is the most common cause of this particular hypoxia. The second common cause is in cases of diseases where the gas exchange is impaired, and the diseases which are causing the impairment of gas exchange, such as chronic bronchitis or emphysema. Here in this condition, what happens is that the oxygen partial pressure is normal, but the gas exchange due to these disorders is impaired, and that reduces the oxygen tension which is reaching the body tissues. This creates the condition which is known as hypoxic hypoxia. Or sometimes there is a ventilation and perfusion mismatch. So you have a perfect ratio at different levels of lungs, the ventilation perfusion. So the ventilation is whatever air which is moving in and out of the lungs, and perfusion is whatever blood circulation is there. And there is a perfect match according to the gravitational forces. So in the standing position, the ventilation perfusion is different at different levels of lungs. But if there occurs a mismatch between the ventilation and perfusion, very commonly it occurs at high gravitational forces, again at high altitude in cases of aviation or space physiology, where the higher gravitational forces are acting. They create a condition mismatch in the ventilation and perfusion, and this leads to hypoxic hypoxia. Or a tricky patient is there and you have given the mask which is leaking, then you have a ventilator where the inadequate oxygen regulator functioning is there. So these are the problems which are occurring at the ventilator level whenever you are treating a patient with the oxygen therapy. Or sometimes the faulty hose connections are there. and that can create the reduced oxygen tension leading to hypoxic type of hypoxia. The second common type is anemic hypoxia. As the name suggests, there is anemia, which is decreased oxygen carrying capacity of the blood. So what happens is the pressure is normal, but there is a problem in the transport of this oxygen. And this can be seen in cases of carbon monoxide poisoning, in cases of hemorrhages or hemolysis, in cases of different types of anemias, or sometimes it is seen as an effect of chemicals or sulfur drugs. So what they cause is the transport of oxygen is abnormal. So the pressure is normal, but the oxygen carrying capacity of the blood is abnormal. And due to that, whatever oxygen which is reaching will be reduced, and that creates an anemic hypoxia condition. Then you have the stagnant hypoxia. Here there is a distribution problem. So the pressure is normal, oxygen carrying capacity is normal, but the blood circulation through the tissue is reduced, and that occurs leading to stagnant type of hypoxia. So circulation is stagnant, it is reduced, leading to hypoxia. And this condition can occur again at high gravitational forces in cases of syncope, which is a condition in which fainting occurs, in conditions of heart failure, or in conditions of shock. So generally, these conditions never occur in a normal physiological state. They are always in a pathological state. Then coming to the last type of hypoxia, where it is termed as histotoxic hypoxia. Now here, the tissue itself is not able to utilize the oxygen which is supplied to it. So there is a utilization problem. So there is inability of the tissues to make use of the oxygen supplied to them. And this can occur due to cyanide poisoning, or due to alcohol and barbiturate poisoning, or due to oxygen toxicity. Sometimes we give 100% oxygen. If it is given more than 8 to 10 hours, then it creates the inhibition of certain enzymes, hampering the oxygen metabolism. And this can lead to utilization problem at the tissue level, causing histotoxic type of hypoxia. So if you want to revise, you have four types. The first one is hypoxic, where the oxygen tension is reduced; anemic, where the oxygen carrying capacity is reduced. Then you have the histotoxic, stagnant hypoxia, where the circulation is abnormal, and the fourth one is histotoxic, where the utilization problem is there. So you have these four types of hypoxia. Now, how these are showing the clinical features. There are commonly in all these types of hypoxia, the patient goes into four types of stages. First one is indifferent stage, second is compensatory, third is disturbance stage, and the fourth one is critical stage. Now, what are the signs and symptoms of these? The first one, which is indifferent stage, it occurs generally around 40,000 feet, more than 40,000 feet. And generally, there are no symptoms. Fatigue is on long exposure at this particular height. Night vision only is impaired, and short-term memory starts deteriorating at an altitude of 5 to 5,000 feet. So this is a particular symptom which is occurring at the mid-level, 0 to 10,000 feet. At the mid-level, the short memory starts deteriorating. So this is the first stage, which is indifferent stage. So it is very difficult to diagnose this condition. Then comes the compensatory stage, where it is occurring generally at around 10 to 15,000 feet. There again, there are little or no symptoms at rest, but if exposure is prolonged or physical activity is there, then there occurs a headache, dizziness, which is a complaint which is given by that person, and sometimes the respiratory and the cardiovascular compensatory responses come into play at this particular stage. So again, very difficult to uh, diagnose this particular condition, but the alarming sign can be headache and dizziness. Then comes the third stage, which is disturbance stage. It is 15 to 20,000 feet. And now here the signs and symptoms develop even at rest. So there is loss of willpower, impairment of judgment, slow thinking, calculation is unreliable, reaction time slows down, and euphoric and elated mental state becomes. So this is a disturbance stage which occurs around 15 to 20,000 feet. And then comes the critical stage. Here in this disturbance stage, along with the previous symptoms, there may be muscular coordination impairment, acuity of vision decrease, touch and pain sensation decrease, hearing also is decreased, but it is last to go, there's tiredness, headache, and cyanosis. This leads to the critical stage which occurs above 20,000 feet. All symptoms become severe even at rest. Mental functions are rapidly declining. Unconsciousness generally comes on with little or no warning, and unconsciousness occurs when oxygen tension falls below 30 millimeters of mercury. If the exposure is prolonged, here, due to cardiopulmonary failure, death can occur, and this is a very serious critical stage. The factors which are influencing to increase the state of hypoxia are these are the causes. Altitude, of course, is the first main cause. The rate of ascent, many a times the mountaineers are asked to go up step by step. So the rate of ascent, if it is controlled, then this can be delayed. The duration of exposure to altitude, individual tolerance is there, physical fitness, psychological stress, temperature, medication, hypoglycemia, and physical activity. So all these conditions can influence the stage of hypoxia. Now, how you can treat it? The treatment given for the hypoxia is, of course, oxygen therapy, and these are the types of oxygen conditions which are given. This is from the nasal prongs, this is a mask, and this is the cylinder which is given. You also have one hyperbaric oxygen condition therapy. And here, at a higher level of atmospheric pressure, the oxygen is given, and this particular oxygen therapy is known as hyperbaric oxygen therapy. It involves the breathing of pure oxygen in a pressurized room or chamber, and 100% oxygen is given. And this is a chamber which is for giving the HbO2. The indications for giving this HbO2 is atherosclerosis, stroke, peripheral vascular disorders, diabetic ulcers, wound healing, cerebral palsy, brain injury, and multiple sclerosis. Many of these disorders can lead to hypoxia, and here you require the hyperbaric oxygen therapy. Very commonly, a question which is asked regarding the oxygen therapy is that what type of hypoxia is most beneficial for the oxygen therapy is most beneficial in that. So if you think of the four types, which will be the most beneficial? The hypoxic type of hypoxia, of course, will be the most beneficial for due to the oxygen therapy. So that is the answer which is very commonly the question is asked, and why it is important because here the oxygen tension itself will be reduced in hypoxic type. So if you give more oxygen, it will be helpful for the patient. But in anemic, as there is a decreased oxygen carrying capacity, in stagnant, the circulation itself is hampered, and in histotoxic, the tissue itself is not able. So, amongst the four, the most important oxygen therapy, most important type of hypoxia, which is responding to the oxygen therapy, is hypoxic hypoxia. So that thing you can remember, which is very commonly asked. Thank you very much. This